Congratulations on receiving a liver transplant. This series of educational videos will give you an overview of some basic discharge information. Over the next few months, your transplant care team will teach you more about what you need to know at your follow-up visits. Write down any questions you may have so you can ask them during your follow-up appointments. In this video, we will talk about how to monitor yourself at home and some of the things you should not do while you recover. The transplant nurse coordinator will give you a monitoring flow sheet before you are discharged. You will need to keep track of your intake, how much you drink, and output, how much urine you make. This is called I's and O's. You need to measure your I's and O's for the first 3 to 4 weeks. Your care team will let you know when you no longer have to record your intake and output. Try to drink 3 liters of water every day, unless your care team tells you your fluid goal is different. If you have a Jackson-Pratt drain, often called the JP drain, record the output 2 to 3 times per day, and record the color and amount of drainage. Your nurse will show you how to care for and empty the drain. Call your care team right away if you have a sudden increase in output, or if the color changes to brown, green, milky white, bright red, or looks bloody. Pink, orange, yellow, and clear fluids are normal. Check your temperature every day and call if it is more than 101.5 degrees Fahrenheit. You will also need to check your blood pressure and heart rate 2 to 3 times every day. Before you leave the hospital, we will give you a blood pressure cuff to use at home. It is important to make sure that the cuff is the right size for you. If you are not sure how to do this, please ask the nurse on the transplant floor to help you. If you need a different size, you can buy another cuff online. You will use a flow sheet like this to record your measurements every day. Bring your flow sheet to all of your follow-up clinic visits for the first month. After the first month, you will most likely only need to record your blood pressure, temperature, and heart rate. When you run out of these forms, you can write your measurements in any kind of notebook. For your safety and for the best surgical outcomes, you must avoid some activities for the first 6 weeks after surgery. For the first 6 weeks after surgery, do not lift, push, or pull anything heavier than 10 pounds. That's about the weight of a gallon of milk. This can be hard if you have small children or larger pets. If that is the case, you can have someone hand them to you while you sit on a chair or the sofa. Do not pick them up or take the pets out for a walk. We want you to start walking as soon as you can. Light exercise is good for you. If you have a day that you are not feeling as well, try to get up and walk around for 10 minutes every hour. However, do not do any strenuous activity, such as intense workouts. Do not bend or twist at the waist. Do not drive until your clinician takes your staples out. You also should not drive if you are taking narcotic medications. These may be your prescription pain medications. Your clinician will take your staples out at your 3-week follow-up clinic visit. There could be areas in your incision that need more time to heal. Some staples may stay in place. If so, the clinician will take them out at a later visit. If your staples are pulling on your clothing, you can cover your incision with gauze. Just ask the hospital staff or clinic staff for supplies when you need them. It is okay to shower with mild soap and water, even if you still have your drains in. Keep the shower head to your back and let the water and soap run over the incision. You can use a light cloth or loofah to cleanse the area. Do not soak your incision. Do not soak in a bathtub, hot tub, swimming pool, or any body of water for 6 weeks. After the incision is completely healed and you have no scabs, you can take a bath. Please check with your care team before you do this. It is okay to put mild creams or lotions around the incision, but not directly on or over it. Keep your incision clean, dry, and open to air as much as you can. You do not need to put a dressing over your incision. It is normal to have some oozing and leakage from the incision. This can be alarming to some people, but it is normal. If you have a lot of drainage, you can cover the incision with the dressing as needed. Pinkish drainage is okay. Call your care team if you notice bright, red, bloody, pus-like, or foul-smelling drainage. Here are some examples of when to call our office. Call the transplant clinic right away if you have any of the following symptoms. You have a temperature more than 101.5 degrees Fahrenheit. Your blood pressure is consistently more than 160 over 110, or less than 110 over 60 for more than 1 day. There is a significant increase in the amount of drainage from your drain or from your incision, or if the color is abnormal. bright bloody red, pus-like, or foul-smelling. Your incision is warm, red, swollen, or is starting to open up. Drain apple color that is brown, green, or milky white. Diarrhea, which is 4 or more episodes of watery stool in 24 hours, or if you stop making urine, or it's an abnormal color, like dark brown or bright red with clots. You have severe pain not managed with your pain medication. Please refer to your discharge handbook for a complete list of symptoms. The transplant nurse coordinator will discuss this information with you in person and be able to answer any questions you may have. You can now view video number 3 in this series. Thank you for trusting Northwestern Medicine.